Assalamualaikum, my name is Muhammad Abdullah. My team number is 54827 and my supervisor Dr. Zuha Rosufila binti Abu Hasan. Today I would like to present my research proposal with title Factor Influence Malaysia Consumer Intention to Use COVID-19 Self-Detection Kit. First we go for the introduction. Introduction they say that on the 19 December, coronavirus 2 is the epidemic outbreak emerged from the Wuhan city in Hubei province at China and spread to the rest of the world. There are few Chinese scientists that isolate the unknown virus sample for an infected person. Okay, according to the Bernama 2020, Dr. D. Zulkifli Ahmad say that they are the first case of the COVID-19 that involving three Chinese nationals who entered Malaysia via Johor from Singapore on 2020 at January 23. And according to the Sun Daily 2021, they're saying that take a self-test kit approved by the MDA, which is a medical device authority, and take it to the hospital to undergo the COVID-19 self-detection kit test at the screening area provided at the hospital with monitoring and verification by the health staff on duty. And then according to Dayak Daily 2021, saying that the price vary retail is a 19 and 90 cents, 90 ringgit and 90 cents per set, while wholesale is 16 ringgit per set. Next, we have a figure that shows about the types of COVID-19 test kit that have been approved by MDA, Medical Device Authority to Malaysia. Next, we go from the proper statement due to the approval from the MDA, self-detection kits are in high demand worldwide at every market level. This because every country want to get the result as soon as possible without delaying to know the result and they can collect all the data for the positive cases in their country. However, the issue arises when accuracy of the detecting COVID-19 virus have been reported in FDA 2020 and about the price have been reported in Harian Metro 2021 and Malaysia Deadline 2021. Here's the article that showing about the price have been reported by Malaysia Deadline, which is saying about the price of the test kit a bit high or a bit expensive for category B40, and in Harian Metro saying that the RTK antigen is a one more times expensive than previous price. From the FDA news also saying about the potential for the false positive result with antigen test for rapid detection of the SARS-CoV-2 related to the clinical laboratory staff and how care providers saying about that even using a test kit COVID-19 test kit test, the result might be positive and negative, and maybe some of them will be positive, but the result showing about negative. And FDA also saying the antigen COVID test may be less effective at detecting Omicron. So it is to find the factor influence Malaysia consumer intention to use COVID-19 self-detection kit. And then to identify the relationship between attitudes, subjective norms, perceived behavior control, perceived price, perceived promotion, perceived product, perceived place, and Malaysian consumer intention to use COVID-19 self-detection kit. For the research question is want to ask about what is the factor influence Malaysia consumer intention to use COVID-19 self-detection kit, and to know about what is the relationship between attitudes, subjective norm, perceived behavior control, perceived price, perceived promotion, perceived product, perceived place, and factor influence in Malaysia consumer intention to use COVID-19 self-detection kits. Next, we go for the literature review part. For literature review part, I'm using a theory of planned behavior, which is a reflect the relationship between behavioral intention and behavioral with attitude towards act or behavior, subjective norm, and perceived behavior control have been read by Hasan 1991. There's a few variables and definition. or variable intention is defined can be defined as the tendency of consumer to buy a brand to take action related to the purchases that are measured by the level of possibility of consumer to make purchase. For attitudes, can be defined as the attitude impact the individual they supervise. It is critical to assessing their attitudes towards ethical and diversity. The another definition they say about attitude is a psychological tendency that is expressed by evaluating a particular entity with some degree of favor or disfavor, or the subjective norm can be defined as the belief that an important percent of group of people will approve and support a particular behavior. Subjective norm also determined by the perceived social pressure from the others for an individual to behave in a certain manner and their motivation to comply with those people's view. Next, we go for the perceived behavior control is the perception of the difficulty of enacting a behavior. Perceived behavior control is the key difference between the theory of planned behavior and the theory of reason actions. And perceive is the acceptance by the consumer or customer when purchasing, meaning the consumer perception that the price of the product is lower than the acceptable price. For the perceived promotion is an important cue which motivate consumer towards purchasing a product. For perceived product is the way in which a customer views a product brand's equity and offers superiority compared to available alternative. For the lastly is perceived place in the sense of the place. The sense of place is the lens through which a people experience and make a meaning of their experiences in the place. Next, we go for the research framework. In research framework, they have a part which is dependent variable and independent variable. For dependent variable, I'm using an intention to use COVID-19 self-detection kit. For AV, I'm using an attitude, subjective no, perceived behavior control, perceived price, perceived promotion, perceived product, and perceived place. This research framework have been adapted from the Agents 1991. Now we go for the research hypothesis. There are seven hypotheses in my research, which is telling about the significance between society attitude, subjective norm, perceived behavior control, perceived price, perceived promotion, perceived product, and perceived place, and the fact that influence Malaysian consumer intention to use COVID-19 self-detection kits. Next, we go for the research methodology. In research methodology, there are three parts of them, which is a research design, population and sampling technique, and lastly, data and collection and analysis. For research design, I'm using a descriptive research and quantitative data. Quantitative data means I'm using a collecting data by give a questionnaire form to all the population. Next, we go for population sampling technique. I'm focusing on Malaysian aged 18 years above and using a pre-check and mortgage sample size table. I'm also using 384 samples and distribute to 400. For data collection and analysis, I'm using online survey distribution plus data collection. For analysis, I'm using SPSS apps to find the reliability, descriptive, correlation, and regression. There is a questionnaire detail, which is I have 9 parts or 9 sections, which is section A to section I. In section A until section G is telling about independent variable category, which is a contain 7 questions of every category. And H is a dependent variable question that contains 7 questions for this category. And I is a demographic question that contains 10 questions for this part. For the measurement scales, from section A to section H, we are using a Likert scales, and for the section I, I'm using a nominal scales. And we go for the reference. This is my reference for me to identify all the factor, all the definition, all the problem statement that I've been passing through, and how to create, to doing this research proposal and research report. There are several references that I'm using too. Thank you.